Hey everyone, this is Dr. Crosby from Harmony Medical Spa. We've had a lot of questions about the Silhouette Instalift and a lot of inquiries about what the procedure itself is like. I've had a client who has agreed to allow me to video her procedure. So if you're interested in the Instalift, we are going to present a video on what it's really like, the procedure itself. Those of you who get a little squeamish, no disclaimer needed. This is basically a bloodless procedure. There's nothing that would make anyone squeamish, even my 16-year-old son who doesn't like the sight of any blood. So without further ado, the Silhouette Instalift.
This video is designed to give you an idea of what the actual surgical procedure is like for the Silhouette Instalift. This is a sterile procedure, so your surgeon, in this case me, should scrub her hands and use sterile gown and gloves. The patient's skin also is sterilely prepped and then draped. Now in our office, our patients are given a little bit of light sedation, and in this case, the young lady in the film has received some sedation. She is not put completely to sleep, but she is relaxed. Once the sutures are opened, then the skin will be completely numbed where the needle will enter and exit. As you can see, I have pre-marked the areas where I want the sutures to be with a little surgical marking pen. You can see some dots on her cheek and her chin, and all of those will be completely numbed. During the procedure, you'll notice that she looks very comfortable. She's neither uncomfortable during the numbing nor during the actual procedure. And this is a really nice procedure which is minimally invasive. So here you can see I'm creating a small entry hole in order to place the surgical suture. Now the Instalift suture is on a special bidirectional suture with two needles. One will go down into the lower face and the other will go up into the scalp. And what you're seeing here is the insertion of the very first needle down into the lower face. And of course, as I'm putting it in, I'm checking the depth to make sure that the depth is where I want it throughout the entire insertion. I do take my time, so the procedure may take a little longer than in some other offices, but I want to be quite meticulous to make sure it's exactly the way I want it. As long as we stay in the correct tissue depth, neither too superficial nor too deep, she will feel nothing. If we get into the wrong tissue plane, then she will feel some discomfort and speak up. And you'll notice throughout the procedure, she just looks extremely comfortable and never complains of pain. So here I'm inserting a needle along the jawline. This is to give some definition along the jawline and to give a little bit of lift in the upper portion of the neck. The really great thing about the Instalift sutures is that they are a bidirectional suture, which means as the suture is put in, we get an immediate lift. The little cones on the suture will grab onto the tissue, and you'll see a little later in the procedure how I'm actually able to lift and reposition the skin immediately. And she's talking to us, letting us know that she's comfortable. Here I'm showing you the cones on the suture. In the beginning, when we started this 4 years ago, we used sutures that had 8 cones. We still use some of those 8-cone sutures, but now we pretty much use the 12-cone sutures, which gives us a little better initial lift and certainly induces a lot more collagen. We know that the collagen forms up to 9 months. I think the histologic studies show that there's still new collagen forming at 270 days. So that gives you a continuous lift, certainly for a good 6 months, and for most people out to 9 months. At 1 year's time, most people who have had this procedure believe that they look anywhere from 2 to 4 years younger than they did prior to the procedure. So now I'm working on the opposite side of her face, and you can see the suture being exited the scalp. It's nice that we have these longer 12-cone sutures now, and we're able to get a little better pull. We're able to use the full length of the suture. And here we are back under the chin again to define that jawline and to give her a nice lift in the upper neck. And there's the first half of the suture in that location. And then you'll see the second half go in through the same insertion site. And that will be exited in front of her ear up in the hairline. And you can see she's sleeping very peacefully throughout the procedure. In fact, I believe we heard a little snoring in this particular case. So it's a very comfortable procedure for the patient, with very little downtime as well. This is a new procedure. It is an Instalift for the brow. And this young lady decided she wanted not only her mid-face and her lower face lifted, but also she wanted a little bit of lift in the brow. She did have a little bit of ptosis or sagginess in the eyelids, and this will lift the brow and forehead a little bit. So the suture is placed along the upper extent of the brow, and then from there it's advanced up into the forehead beyond the hairline, and will come out up in the hair and give us the ability to lift in the brow as well as lift the mid-face and the lower face. And that's the first half of the suture. And the second half is going in, and through that we'll get a nice lift in the lateral brow. It does help to have a little bit of Botox in the forehead before the Instalift if you're going to do a brow lift, so that your strong forehead muscles cannot pull against the suture. Now here what you're seeing is I'm using a little bit of sterile saline on my finger for a little bit of slip, and I am seating the cones into the soft tissue. And I've just asked her if she feels comfortable, and she answered yes. She's still very comfortable. So as I press down on each of those cones, you can almost hear them snap into place, grabbing onto the skin and the soft tissue, so that when I pull to tighten that suture, we'll get an immediate lift. Each suture is gradually tightened then by stroking the skin backwards from that lower insertion site. And again, you can tell she looks very comfortable here. And now we're doing the same thing on the opposite side. You can already see she's got a little bit of lift in her cheek on her left. As you look from this angle, you can see her cheeks a little bit higher on the left. All that soft tissue of the lower face has already been lifted. The other thing I thought I might mention is you can tell that this is a pretty bloodless procedure. The needles are wicked long looking, but they are so tiny in diameter. They're actually not that much bigger around than a Botox needle. So there's almost no bleeding at all. And now I'm working to tighten the sutures on the right side of her face. And we're going to work very hard to get a nice symmetric lift and better definition along her jawline. And that is one of the sutures along the jawline right there that I'm working on. And she's still sleeping very peacefully. So here we're going to cut the sutures off so that nothing will remain outside the skin at the time she leaves the office. And I'm using an instrument to give me a little extra pull so I get that little tiny bit of extra lift. We've noticed that if we overcorrect our lift by about 20% at the time of the procedure, we get a nice lift about a week afterwards. On occasion, we'll see a little bit of dimpling, especially at the angle of the jaw, where the suture kind of turns and goes up in front of the ear. Those little dimples can last anywhere from 7 to 10 days. We've never seen them last longer than 2 weeks, and they always resolve on their own. There's also a little bit of dimpling in the brow area if we decide to do a brow lift in addition to the mid-face and lower face. And those dimples resolve in a week to 10 days as well. So here we are lifting the brow and giving her that last little tug to really get things elevated. So you can see now the before and after photos of a very happy client after Instalift.